Good morning, Carol.
Good morning, Bob. Happy 2021.
Oh yes, this is our first broadcast of the year, and I think we should start it out by saying congratulations to Senator-elect Raphael Warnock of Georgia, and hoping for some news on Senator Ossoff shortly.
It's still tight, huh?
Yeah, yep. I have a good feeling about it, but
I do
we'll
too.
know. We'll know for sure, but I think it's going to go in the right direction.
Yeah, I think so too.
Hmm.
Yes, absolutely. We need, if ever we needed a change, we need it now.
Right now.
Oh, yeah, right now.
So this is the COVID update. Let's update people on COVID. So here in New York, the UK strain has now been found in New York, according to Governor Cuomo.
Yeah, this is what, number two?
Hmm.
The second person, the first
Uh,
on the West Coast in Colorado.
Right, exactly. Well, there
And
there are actually four known cases in the U.S. now, um, but we have one in Saratoga County in upstate New York. And the disturbing part about it is that the person has no known travel history, so they have no idea how he got this particular strain. And this strain, it spreads faster than the strain that we've had, although they're saying that it is not necessarily more. It doesn't kill people more, but it spreads faster, and spreads faster means it still ultimately can end up killing more people.
you know, um, yeah, that's an interesting thing because the first man didn't have a history either, a travel history either.
Hmm.
And so the question still remains, where did it come from? But again, Thanksgiving, Christmas, and in another week, you'll hear the New Year gathering numbers.
Hmm.
Yeah.
Yeah.
So, it I don't think it just walked over here. You know, I don't think it just walked over here. So, Um, he had to have been around, and I'm not even saying in um like gathering with anyone.
Hmm.
They said it's easier to catch. Could have just been in a supermarket where you didn't, continue to socially distance. A
Hmm.
lot of stores are not doing that anymore. Lots of
Hmm.
people are just crowding into the stores.
Hmm.
So you just really, really don't know.
Yep. Absolutely. So we got another story about the CDC, and they have finally issued some updates as far as we've heard reports about people having allergies and having severe reactions to the vaccine. So the CDC has come out and basically made some recommendations that anyone with a history of immediate allergic reactions of any severity to any component of these vaccines or to polysorbate should not be vaccinated, they say. And so evidently there's something in the vaccines, polyethylene glycol or polysorbate. And if people have a history of reactions to these things, they should definitely not take the vaccine, or they should be referred to an allergy specialist to determine whether they should be taking it or not.
So there's two things. One, as you said last week, if you use an EpiPen, you shouldn't be taking it.
Hmm.
Um, Two, the doctors are working on actually three things. The doctors are working on um, vaccines, or really looking at the vaccine to see why people would have that allergic reaction. The other
Mm-hmm.
thing that they're working on, um, giving the injections closer together. As we all know, it has to be 2 injections. One is like 21 days apart, and one is
Mm-hmm.
28 days apart. So they're working on shortening that time, because someone did get, it was a healthcare professional who got the first shot and still got
Mm-hmm.
COVID while they waited for the second one. So you need
Right.
both to get the immunity. So they're working
Right.
on lessening the time frame between the two, and of course they're still working on that one shot.
Right.
Get the
And
vaccine in one shot.
mm-hmm. Yes, this is that situation you're talking about happened in San Diego when a local nurse tested positive more than a week after receiving a first of the 2 doses of the Pfizer vaccine.
Right. So again, this is the time to like really, um same time while we're looking at things and we're doing our reflections on last year, where we want to go this year. This is the time to educate
Mm-hmm.
yourself, to look,
Mm-hmm.
and don't do it fear, don't do it in fear. Just look at it
Mm-hmm.
realistically and make a decision, and be honest about it. Don't say you don't have allergies because you just want this thing to go away. You're causing yourself more harm than good.
Mm-hmm.
That's not, that would not be a good thing. So just pay attention to the science. It's out there, and we do our best to bring it to you.
Mm-hmm.
And there's enough to look back at. You can always look back at the tapes that we've done from last year.
Mm-hmm.
Subscribe to the YouTube channel, go to Facebook, Harlem Emergency Network. You can go
Mm-hmm.
back, you can pull up information, videos, newspaper articles on, what we've been talking about for these last over 10 months,
Mm-hmm.
close to 10 months.
Yep. Yeah, this is our 42nd episode.
Wow.
Crazy. There's another story out where studies are reporting that there is a lot more. I guess they're saying the biggest revelation over the year is that the oral route is a point of entry into the body, and the digestive tract is a primary organ system for the virus to multiply, replicate, and potentially spread. And so it was in the early days, it was thought that this was primarily kind of a pulmonary disease, that it would hit the lungs and work its way out there. But they're seeing more and more evidence that it can come in through the stomach and create all types of havoc in your intestinal tract as well.
I tell you, boy, he said it's just a gift that you don't want, because it's a gift that just keeps on giving.
Absolutely.
So many different ways this thing keeps moving,
Hmm.
and it's difficult to keep track of what it's doing. I think in the same way it mutates, and we have this new strain, it's pretty similar to the symptoms. Early
Hmm.
on, you was hearing about a whole lot of different symptoms that you're not hearing about now. Blood clots, different things like that. Especially they were found
Hmm.
in African American men, where we knew that it was disproportionately hitting Africans, African Americans, and the Latin community, and the Native American community.
Hmm.
So I was wondering what happened to that information.
Hmm.
Why were they no longer talking about it? And then, you know, I said, well, look who it's happening to. So maybe that's a good reason why you wasn't hearing it.
Yeah, I mean, in the early days, it was skewing very heavily toward African Americans, and is still probably, overweighted in terms of incidents in our community. But as this thing started to spread later through these super spreader events, I'm sure that that demographic has shifted, because there's been a lot of super spreader events that were not not a whole lot of us in these events, and a lot of those people are making up the death toll that has now reached, what are we at, 340, 350,000 people at this point in time, and rising.
Right, but we were doing our own. We were doing the thing, the family spread. Like they said, that's where it's spreading most in the
Mm-hmm.
family
Mm-hmm.
gatherings. Too many people in one places. That's
Yep.
where we were, having a lot of trouble getting
Mm-hmm.
through. People did not recognize family gatherings. It was
Mm-hmm.
always said immediate family,
Mm-hmm.
immediate family, the people who live in the household.
Mm-hmm.
But we are known for party and hardy and getting together, and especially at holidays.
Mm-hmm.
Those numbers were going up around summertime. There's a lot of us barbecuing, a
Mm-hmm.
whole lot of backyard reveal parties and gender reveal parties and wedding receptions. And that's where we fall off.
Mm-hmm.
There were a lot of super spreader events when I couldn't even believe the insanity of what it looked like in Florida with all of those people at all of these different clubs and bars, just crowded. Excuse me. Some in the
Mm-hmm.
street, just everybody's got a drink in hand and they're dancing to the music, and there's no mask, and of course, there's no way to distance themselves. I couldn't believe that insanity. It's like people are looking at this as a joke. Like, can I beat the clock? It's like something from the Twilight Zone. Let's find a way to outrun it. It's not going to hit me. Michael
Mm-hmm.
Jackson, I'm bad. I'm bad. Sure enough, I'm bad. I don't understand it. This is not something you want to take a chance on getting. And yet
Yeah.
that part is not getting through to people.
Mm-hmm.
These are not young people. They're not necessarily young people. People say, well, the teenagers, they don't want to hang out. They don't want to hang at home. They want to be with their friends. These were not teenagers.
Mm-hmm.
These were people that were more than old enough to kind of figure something out. And I had
Well,
to.
we hope that here in 2021 is going to be a return toward people actually looking at fact-based evidence that that they make their decisions on, and not just going off a lot of wild speculation and rumors, and then finding out the hard way that they're wrong.
Yeah, I was out yesterday, and I'm saying I thought we were supposed to be still going into sort of a shutdown of sorts in the streets,
Hmm.
the stores. I changed my mind in terms of shopping. I went and I got
Hmm.
2 items, and I was
Hmm.
out. 2 items, and I had to get out of there. Too many people, the streets. Oh my gosh! I was on the bus. The drivers fighting. Thank God I wasn't on that bus. But the bus drivers are still fighting with people with the mask on. That guy was there for over 5 minutes. I'm not moving this bus until you put your mask on. So apparently they got on with it and took it off. Or they
Ridiculous.
got on in and he was adjusting the seat or something that took his eye off of her or whatever. But Um, 5 minutes. He's fighting with this person. I'm not moving. You have to get off my bus.
Mm-hmm.
They wouldn't get off. He wouldn't move. And
Wow.
finally, the person put the mask on. I'm like, I don't even understand why we're still there.
Right.
You can't wish this away. You know, I mentioned the Twilight Zone. I love the Twilight Zone. That's my habit.
Mm-hmm.
It's all the addictions that people could have. But the Twilight Zone, and there's one with the little Billy. It's a Good Life, where he has this ability to turn people into strange things, jack in the boxes, and all kinds of stuff. And I'm sitting there looking at this person. I'm like, people are actually acting like you could just wish this thing away. Every time he would create some strange creature, like from a cat, a dog, and a cow, he could just create these things like that. And they would say, wish it into the cornfield, Billy. Wish it into the cornfield. And it's like people are trying to wish COVID into a cornfield somewhere. Just close their eyes and, you know, it's gone. And it's never going to go away if we don't pay attention and stop the madness. People are tired. They're like, oh, I'm tired. Let's leave everything in 2020. And let's not talk about it. You can't leave the virus in 2020. It came into 2021 with us. I mean, really.
I don't know. There's just some common sense that just seems to be lacking. So another story that we're seeing is there's been some turmoil with healthcare workers in terms of who's getting the virus. First, one story is that there are a number of healthcare workers, up to 30% of them, that are declining to take the viruses, and that's an interesting story. Um, and the other story is that there are certain situations where what's happening is that there are healthcare workers getting the vaccine. I meant to say vaccine, not virus. And but some of the healthcare workers who are getting the vaccine aren't the frontline healthcare workers. And they had this problem out in Stanford, California, where they had a hospital. I have to read this story for you because I just found one part of it just hilarious. It's not funny, but it was funny to me. Uh, so Stanford apologizes after vaccine allocation leaves out nearly all medical residents. This story was reported by NPR. And so apparently they had some sort of honor system where the residents were supposed to, most of the residents were not able to get the vaccine, including the ones who are doing all the frontline work. And it had them in sense that some of these residents have been wearing N95 masks for 10 months, and they haven't been having any kind of transparent and clear plan for their protection. And why is some doctor who does cosmetic surgery, who's been working from home for 10 months, get the vaccine, and they don't get it? So the part that I found hilarious, I have to share this with you, is how the leadership reacted to it. I got to find this quote because I was reading this thing at 2 a.m. and it just made me laugh because you know how people find a way to address your pain and make it like I'm hurt that you're that you don't believe that our let's see if I can find this quote.
Mm-mm-mm.
It was
There's always going to be that going on. It's always going to be something. It's never going to go perfectly.
mm-hmm.
There's always going to be people like the people we spoke about last time who are selling it on the side, who's making money on the side. giving it to the elite people. I mean, look at
Hmm.
your last administration. They were getting that cocktail that nobody else was privy to.
Right. Exactly. Exactly.
So and now this is no different.
Hmm.
You're gonna find the same kind of shenanigans.
Yeah. Unbelievable. So it's this seems to be a pattern that we've always seen, is that somehow or another there is a way for people to jump to the front of the line. We had that here in New York, where you had the this urgent care center who somehow managed to get their hands on vaccines and distribute it to people who were not on the early distribution list.
Hmm.
Uh, so
And we
and
can guess which neighborhoods that didn't take place in.
So it's still a crazy situation with this virus going into 2021. And I had a very, very good friend that I found out a couple of days ago tested positive. And I say the same thing. The same information we share is that your best bet is to make sure that you take the certain things that you know that can help boost your immune system. And whether it's vitamin C, vitamin D, it's zinc, and it's melatonin, it's getting a full night's rest, it's hydrating. All of these things contribute, and anything that you can take that has antioxidant properties are also helpful. So we just recommend that people look. You have to take care of yourself. It's we're still not hearing enough from health officials about just what do you need to do between the time you find out you test positive, so that if you haven't had the vaccine, at that point in time the vaccine is not going to help you. What's going to help you is boosting your immune system, and there's still not enough talk about that, and I find that disturbing.
That's beyond disturbing.
Hmm.
Later on, much, 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 much later, you know, health department officials were saying, "Oh yeah, 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 you need to get those vitamins in your system, no matter what. Just overload yourself with stuff." But it's so interesting how we were fought in the beginning.
Hmm.
You know, that some of those same people said, "And it's no big deal. You don't have to. You need to go to a doctor to decide whether you should take the vitamins, what vitamins you need." Well, those were not choices at the time. The hospitals were on lockdown,
Hmm.
you know. So you can't say 6 months later, that's what you need to do. Everybody needs to just pump themselves up with vitamins. It doesn't matter. Eat healthy. Yeah, we always advocate healthy eating, but just get those vitamins in your system. I'm like, really? It took 6 months to say that? And we were already saying it, and people were going against that. But you know what? It all comes down to, again, doing your own basic research.
Hmm. And
That's what.
we still want to talk about ivermectin, which is a drug that's won a Nobel Prize, that has antiviral properties. That there's a lot of evidence that doctors are talking about. More and more doctors are talking about ivermectin, but it's still not something that most people have heard of. But one of the things about ivermectin is that it's had positive effects in terms of prevention, or as the doctors like to call it, prophylaxis,
Mhm.
for COVID-19. And so I encourage people to Google ivermectin. Here's a website you can go to. You can go to this address and see more information that doctors have gathered on ivermectin. And if you test positive for COVID, I would ask, your own physician about it. So these are some of the things that are having effects. Most of us are not going to have access to the vaccine in time to prevent the surge that we're having right now. And so it is incumbent upon you to use every means at your disposal to protect yourself. And I know that myself and Carol Johnson, we take these supplements. We look at the things that we're eating. We're making sure that we get these nutrients from whatever food sources we can, and supplement sources, and just make sure that our bodies are in the best effect. That if everything that we done, if we washed our hands, if we wore the mask, and still somehow this tricky virus slips in and gets an opportunity to get inside our bodies, we want to make sure our bodies can handle it. Plain and
Right.
simple.
Now, and it's still a matter of, even with the ivermectin, who has insurance? How would it be covered?
Hmm.
Everything is a money's game.
That's it.
I mean, look how long people had to wait for a little lousy $600 second stimulus check.
Hmm.
Are you serious, America? This is absolutely beyond unacceptable. And
Hmm.
so when we're talking about life-saving medications, everything comes down to a dime. Will your insurance pay for it? Even if you have insurance, what kind of insurance do you have, and will it pay for it?
Hmm.
I mean, because look, we're still looking at all of these testing sites that are still in black and brown areas that are charging from $300 to $1,000. So as
Hmm.
much as it's said that the testing is free, where are the people going to these places and shutting that down?
Hmm.
Because that's what we've got in abundance. So I'm looking at the document from, I get the all the testing sites. I get a map and a flyer with all the testing sites that's taking place in each borough.
Hmm.
Some of them are pop-ups, which mean they're only going to be there maybe from 3 to 5 days. Some of them are self-testing sites. And so we had a self-testing site that was self-testing is they'll give you a swab, and you have to have a valid ID,
Hmm.
valid email address, and they're going to send you an email, and you have to validate that you received that email. Then they'll give you the swab, and you swab around your own nostril, 10 seconds in each nostril. So I go out. Yesterday was the first day that this site was to open, a few blocks from me.
Hmm.
No site. Well, that's my job. I did that during this whole entire pandemic,
Hmm.
checking on those sites, and it was very disturbing.
Hmm.
That was the first time the site wasn't in the right place. 10 months later, we still cannot get you to give us a valid address in places. So I go there and I see this door open. They had the little, what we used to call the prayer rooms,
Hmm.
and I'm knocking on the door. And I said, well, where is it? I know this is the address. So then I stand outside the building. I sit outside the building, and this lady comes out. And I said, is there testing taking place inside? Because a lot of these pram rooms, you can enter from the outside, but you also have access from inside the building.
Hmm.
So she said, well, wait a minute. And she went back and she looked down the hallway. She said, no, there's nothing going on here. So that's when I saw this flyer on the wall that said that the testing was on the next block. And I'm like,
Ridiculous.
why can't we get this straight? Why can we still not get these things straight?
Hmm.
They keep happening in our neighborhoods.
Hmm.
And I sent it back to the mayor's office. I said, no, once again, you got it wrong. This is where it is. And I went there and got tested. It's a quick turnaround. But look at that. We lost the whole day because we had to get back in our social media pages, back into our hub, and turn it around and let people know, sorry, that was the wrong location. And that's not good. That's not good for organizations like ours because we work very hard to build our reputation.
Mm-hmm.
And to have people stop believing us because we're printing erroneous information, no fault of our own, this far into the game doesn't make sense. Still doesn't make sense.
At all.
At all.
So I want to finish up with a positive story, and there's sometimes few and far between. So there's a report that there are chemical compounds in foods or beverages like green tea, grapes, and dark chocolate that can bind and block the function of a particular enzyme in the SARS-CoV-2 virus. And this is according to a study by plant biologists at North Carolina State University. And so the good news is that the foods that they're finding these chemicals in, these flavonoids, are foods such as grapes, strawberry, blueberry, persimmon, cacao nuts, chocolates, and wine, and green tea. So eat up, folks.
I guess I better go get some dark chocolate.
Yeah, get some dark chocolate, get some cranberries and blueberries, drink some green tea, and you might need a little bit of wine. And now you got a good excuse. So
a little bit, people, a little bit.
Yeah, a little bit. Yeah. So I hope that information helps people out. We like to try to continue to keep our spirits up no matter what's going on here, and find out a way to share information so that we can all get through this as best we can. So
yes, indeed.
So check back with us next week. We're here every Wednesday morning at 9:30 with the latest and most up to date information about what's going on in our neighborhood, in our state, in our country, and in the world concerning COVID-19.
Yep, we'll be back. Good to see you guys.
Yep.
But let's remain thankful and let's remain hopeful. But also, most of all, let's remain thoughtful.
Yep.
Remain thoughtful. Right. Nobody should have to explain to you why you need to have a mask on or distance yourself. Mm-hmm. So let's continue to do these things. And the more we do these things and stop with the gatherings, the sooner there's a possibility we can get on the other side of this.